It may be astounding in this day and age, but 1 in 7 women with varicose veins are having the wrong or incomplete treatment. The result of this is that 1 in 7 women can expect to get their varicose veins back again, even though they've had their veins treated by a so-say expert. The proof of this is due to even more research that's come out from the Whiteley Clinic that has been published internationally. Research performed at the Whiteley Clinic that's been looking at pelvic congestion syndrome and the causes of varicose veins over many years has now shown that 1 in 7 women who have leg varicose veins, or 1 in 5 women with leg varicose veins who have had children, actually have varicose veins coming from the pelvis and causing their leg varicose veins. The research that proved this was performed at the Whiteley Clinic when we looked at the patients who had been referred to us in 1 year from other clinics who had had all their veins come back again despite having the best surgery those clinics and hospitals could provide. When we looked at the causes, we found one of the major causes was the fact that most people, when they treat varicose veins, do not check for pelvic varicose veins. It turned out that 1 in 7 women and 1 in 5 women who'd had children had veins coming from pelvic varicose veins into the leg veins, and it was because the doctors hadn't recognised that, hadn't looked for it and hadn't treated it, that the varicose veins had come back again, and those patients had to come to the Whiteley Clinic for their proper treatment. This has huge ramifications for people having varicose vein treatments, especially if you don't want to keep going back and having your veins treated again and again and again. Every woman who has leg varicose veins, particularly if they've been pregnant and had children, should always be suspicious that they may have a pelvic cause for their varicose veins. And any clinic doing this sort of procedure should make sure they've got the facilities to do a test to see if there's pelvic varicose veins. What's really important to know is that the test that has been shown to be very best for looking for varicose veins is a thing called a transvaginal duplex ultrasound, which is an internal ultrasound scan that can see these veins up close. CT, MRI and venography, although they sound very important tests, don't actually show the flow in the veins, and the size of the veins has been shown by research published from the Whiteley Clinic to be irrelevant as to which veins are a problem. Any test like an ultrasound from the outside or a CT or an MRI that just looks at the size of the veins, or a venogram that again looks at the internal size of the veins, does not tell you whether you have pelvic varicose veins and whether they're causing a problem. Any patient who comes with varicose veins to be assessed at the Whiteley Clinic gets a full assessment under the Whiteley protocol. If the veins are simple, that's fantastic, we don't need to check the pelvis. But if we can see with a simple scan that veins are coming from the pelvis, and this might be the problem, then we have the test called the transvaginal duplex ultrasound scan to hand that we can offer so that we can make the correct diagnosis and offer the correct treatment.